Tell us a bit about kind of yourself and what you're up to these days.
Okay, well, thanks for the invitation, and thanks to Max, who I met at City University. It was about a year ago, wasn't it, Max? I think it was, something a while ago, for the invitation. So I kind of have a number of hats, like most people do in this day and age. And my day job is I'm a cancer surgeon, working at the Royal London Hospital. I'm a colorectal cancer specialist, and I've been there for more than a decade doing my clinical practice. In my kind of spare time, if you like, that I have over that, I run 3 or 4 tech companies. I've been involved in the kind of transformation of digital health into medicine, trying to change the way we think about how we design both education and also sharing knowledge on a global scale, but also how we change clinical practice and change the mindset of the doctor-patient relationship, how we introduce technology to improve healthcare outcomes around the world. So that's been kind of my interest for a number of years. I'm also an associate dean in the medical school, so I've been running medical school for the best part of a decade as well. And I've been teaching surgeons from day one to the time they're consultants. So I've been involved in the whole teaching training program from an undergraduate to a postgraduate to becoming a fully fledged surgeon. I've also been involved in a lot of global health work. That's my other passion. I do a lot of humanitarian work in war-torn zones and places that people can't get to. In fact, I'm supposed to go to Gaza next week to do some humanitarian work, but that might not happen given the current context of crisis at the moment. In the last 3 years, I've been to 30 countries. I advise many governments on healthcare and systems and how we should improve them, how we use existing resources to think about how we improve efficiency of healthcare, make it more accessible, more affordable, using technology. So I've kind of got a kind of global interest in how we improve the lives of not just a few people, but millions and billions of people.
Amazing. I love your phrase, in my spare time. Away from being a cancer surgeon, I also, yes, okay. I think you're putting the rest of us to shame. But tell me about this most watched surgeon. What's this all about?
Oh yes, I've been experimenting with the way we teach. So let's go back. Surgery is being taught for many years in the operating theatre. And often we have 2 or 3 students. And often all they see is the back of your head almost for 8 hours a day. This is historically true. We have an operating theatre, students come along, really energised, enthusiastic, they're at medical school, they want to learn, and in the back of the room for the whole day. And all they do is on their smartphones, on social media, on Instagram, on Facebook, on Twitter, just looking at things. And they hardly ever see what's going on in the theatre. So I don't think that's engaging.
Sure.
And certainly not a good model of learning.
Sure.
They spend, £9,000 per year for what I call a process of diffusion osmosis of learning, right? Not active learning. So I've been experimenting with wearable technology, with Google Glass, to think how can I teach people, not just close to me, but on a global level, connecting people around the world. So we used Google Glass 2014 when it first came out. I was on Explorers. I literally live streamed an operation using the technology which we kind of reconfigured, and that streamed to 14,000 people across the globe, 118 countries, simultaneously teaching them. They could text a message, or they could come on the glass, I could answer at the same time, interact with people. We then moved to virtual reality, and I used the whole VR tech to live stream the first VR operation in 2016, and that reached, I think, an audience of 55,000 people in 140 countries. It's simultaneously training people with the concept of surgery. And then I decided to do something even more crazy. It was social media, which really made me famous, I guess. Snapchat. Can you imagine Snapchat? Now, most of you probably haven't got Snapchat. And I'll tell you why, because you're too old in the audience.
Yes.
I say that because there's 200 million users of Snapchat in the world, and 75% of those are between the ages of 17 and 25. So irrelevant to us maybe, but not really. Those days are my medical students, my trainees. Yeah. So I said, okay, let's stream an operation in Snapchat using spectacles that came out when it first came out. We pushed it out in 10-second bites, thinking, how do we train people using social media? Is that the outlet? I did that. I was very careful about this. I was a bit unnerved by using social media for surgical training. So we did it. It went viral. I think it was watched by over 2.5 million people around the world. Yeah. Suddenly the audience was just massive because students, you have to put yourself in their students' position now. What are they? Who are they? They're digital natives. They understand different things better. They want access of information immediately on social media. Yeah. So you give it to them in that format. They respond. And if I operate now, I have something like 5,000 to 10,000 Snapchat students that just watch what I do.
So you totally, and presumably that makes for better doctors, surgeons in the end as well, because by transforming that experience, by giving them the kind of almost the surgeon's eye view, you're helping them see things in a much more realistic way.
Yes, two things. One is about the point of view approach. You're seeing in real time what's going on, you're interacting, but also I think our job as surgeons is to inspire people around the world. We want to connect the people in a different way. So I'll give you an example, a really nice story actually I'll share with you. One of the days I was teaching on Snapchat and asking my audience, who are you, where are you watching it from? I don't know, because you don't really know who they are. And I've got all these text backs, I'm from here, I'm from over there, all around the world. And one girl actually responded. She said, hi, Professor Ahmed, my name's Ella, and I'm a third-year medical student, and I've been watching you from the Marianas Islands. So I thought, where the hell is that, right? So I Google Earthed it. I zoomed in to the Pacific Ocean, one little island in the middle of the Pacific Ocean, near Guam, of 13,500 inhabitants. I was teaching her from there. Is that about the world being connected in a way that we have not done before? So teaching in that sense makes it much more inspiring.
And it seems to me you're also using existing technologies, things they're familiar with as students.
Yep.
And so the kind of the capex, as it were, the cost of setting this up is actually presumably relatively low.
Absolutely. The way we impact the world in healthcare and education, it's high fidelity, low cost.
Right.
So when I did the VR experiment, all I was requiring people to do around the world is buy a Google Cardboard, which is what, $3, $4, $5 maybe. A smartphone, which is ubiquitous, a free app, and suddenly they can transport themselves any operating theatre in the world just by putting the VR headset on, making that knowledge base so accessible. So I always tell people, don't think about sharing knowledge with one or two people, think about sharing with tens of thousands of people. Because ultimately, who are we? We are people who've got knowledge who need to share, leave that legacy behind. And what a better way of doing it by connecting people on a global level. And that's why I keep telling people, don't think about just one or two people, think much bigger.
It's very 10 times thinking, a very Google sort of moonshot way.
Sure.
Can we maybe see, because Shafi's actually performing.
Yes. So let me show you something. What are you guys doing tomorrow evening, 10 o'clock? Sleeping? Getting ready for bed? Well, so first of all, I had to, shameless plug, I run a health tech conference called Giant next week. This is the intersection of all global technologies coming in to healthcare. Come along to Chelsea Football Club next week. You'll see some amazing speakers talking about how healthcare is changing and transforming. But I'm famous now. I'm on Channel 5. I'm their kind of poster boy for the last few weeks, all right? They've been following me on for the last 10 weeks. I've had a whole team around my theatre, around my team, etc. I think they're pushing the boundary. They've commissioned a group called Garden Productions, who are the same people who did 24 Hours in A&E and that kind of thing. And they've thinking about, for the first time, British TV, showcasing live operation in real time, so you can all watch it together. So it interlaced with VTs, etc. edits, and they gave out this amazing video the other day, which you might share. Volume?
From the first incision to the last stitch, experience the extraordinary skill and all the drama of an operating theatre live. Their lives, his hands. Operation Live, coming soon to Channel 5.
That's tomorrow, so 10 o'clock, come and join me and tweet your experiences about, it's a patient who's got a cancer, who's very happy to first film in. We've been through this for 6-7 weeks, making sure that we mitigate risk as fast as possible, and then we'll be showing a live surgery on that day. So please join me.
Fantastic. So you know what you're doing now tomorrow evening. Now might be a good time to sort of pick up any questions from the audience at this point. I've got plenty more, but just want to make sure we're kind of opening it up. Down here, the lady down here.
I imagine you are very reliable on the network. And what about lag times in your live operations?
Yeah, it's a good question. I don't think lag times are a problem, actually. People are obsessed with lag times, almost. I think if you're doing an operation transatlantically, we need that immediate kind of connection. I agree. And that operation was done years ago. Operation Lindbergh in 2001 was actually a live operation from New York to Paris. That's essential. But actually, a few seconds delay, it does make a big difference to teaching because interaction is still much the same. So I've not noticed. The Google Asks that we have made with a company called AMA, which are based in Rennes in France. They've put the lag time down to about 0.2 second or 0.2 minute. Yeah, it's pretty cool. So it's not even noticeable. And we use telemedicine platforms now. They're much more sophisticated. They're really quick, almost in real time. So it's not been a problem.
Can I ask also for when 5G is available, you can have no lag time.
Absolutely.
So can you do your surgery
Absolutely. I'm really
on
glad.
someone anywhere in the world
Yeah, I'm so
with
glad
the
you-
introduction of 5G?
I'm so glad you mentioned that. That's going to be part of our conversation going forward about IoT, 5G, what's going to be connected. I had an interesting conversation with the head of Vodafone only last week about what the mission was with 5G, how they could market it properly, what's the use case. I think the use case is healthcare. Absolutely. It's about telemedicine. It's about remoteness. It's about teaching. It's about accessing patients, for example, medical records or real-time conversations or even surgery in the future. Robotics is coming in, and now in the next 18 months, you'll see a plethora of robots coming into the surgical field. I happen to be an advisor for the Google team who've joined with Johnson & Johnson to create the Verb connected robot. I've been to Mountain View only in the summer as one of the first 3 people to see the new robots coming out. So you'll see a lot more sophisticated robots, more connected. Ultimately, if they're connected and then they use more data and analytics, we can sense a time in the next few years that we could do remote operations in the future. I'll show you a few videos in a moment about how remoteness is important, using holograms, VR. And I've been using that to train people abroad and experimenting with different designs, which we'll show.
So what are the kind of technologies that you see? Because there's a lot of news about Amazon coming in or Apple coming into healthcare or Google. What are the things that you see as really going to be transforming healthcare in the coming years?
It's really interesting. So I think if you look, when Klaus Schwab sat up the World Economic Forum and said, look, this fourth industrial revolution kind of, paraphrase, I think what he's referring to was medicine.
Right.
Not any other vertical.
Yeah.
Because medicine is the perfect opportunity for all those technologies to be put in place. And I think today, I always tell my students that they don't believe me, this is the most exciting time to be alive in medicine. Okay? Despite what you hear about the NHS and the problems we have, it is exciting. Yeah. So the technologies that we describe, blockchain, of course, that's going to be much more secure, electronic health records going forward. Augmented virtual reality will revolutionize training, etc. Telemedicine. You've got the whole AI interface using chatbots, information, and deep machine learning, like Babylon and other companies are producing AI chatbots. The nanobiotechnology, having nanobots can be important, and genomic profiling is becoming cheaper and cheaper. I mean, whole genomic sequencing now used to be like, when I did my PhD back in 2000, it was over many millions to produce a sequence. Now you can get your own sequence done for less than $1,000, about $500. In 2 years it'll be $10. So everyone can have their sequencing done, producing lots of data. So all these things are coming together, the convergence. It's amazing. We're going through this exponential growth in medical technology. People talk about singularity coming at some point. But actually what we've got now is a convergence we've never had before, such riches of technology, all impacting healthcare at the same point. And that's exciting. So it's for us to figure out, what does it mean?
Yeah.
How do we kind of figure it out? What I think the real advantage is that if you think about healthcare around the world, no one's got any money. I've been to 30 countries, health ministries, seeing governments. No one's got cash. Surprising, right? No more money for healthcare. So there's the problem.
Yeah.
No more money. So how do we redesign healthcare?
Yeah.
How do we create healthcare that's more affordable, more efficient, using technology, take away some of the burden of healthcare, making it more accessible to more other people? And that's the mission between these global companies, governments, thinking how do we redesign healthcare? We can't afford it. We can't carry on.
Yeah.
We'll go bankrupt fairly quickly. So we haven't got a choice as a human kind of species on this planet to think about how we do it differently.
And I was listening to the CEO of Ford talk the other day about, and one of the comments he made was about, what do technology companies know that the rest of us don't? And the answer was Moore's law. Everything is getting twice as fast and twice as cheap. And almost if you plan for this, and Steve Jobs was very good at this, it's ridiculously expensive right now, but what he knows or what he knew was in a few years' time, it would be sort of there in everything. And actually you've just got to find a way to afford it right now. So in a way, it seems to me, and we hear about the NHS, we hear about aging populations, there's this really is the far side chat. That it actually, healthcare needs to embrace digital transformation, because that's going to be what transforms the cost equation. Yeah,
it is. I mean, if you look at America, and I was come back from America last week, their affordability is really low. I mean, you can't afford healthcare as it is. Hugely inflated prices. So if someone like Debbie Shetty in Bangalore can do a cardiac bypass operation for $1,200. He's revolutionised, democratised cardiac bypass. Wow. The same operation in the US would cost you $250,000. So there's the kind of inequality about how we manage. Yeah. So you really got to redesign, rethink how we create healthcare. One of the things I think is important to understand is that we kind of got to a stage where, as human beings, we're kind of, I call it one-click generation. We have Uber, we have Amazon, we have Hungry House, we have Just Eat. So if you think about it, this is the interesting part. So Uber, if you go for a taxi on Uber, you wait for it, you click it, it says like 15 minutes. You're so upset, right? Oh man, I'd rather walk. I'm not hanging around 15 minutes. You know, where the hell's the taxi? Similar to Amazon Click, we now want a book within 2 hours. Yeah. For what reason? I have no idea why we have that mission. We have to read that book in 2 hours. Makes no sense. And similarly, Hungry House, Just Eat. You order food, if it says an hour and a half, you're hungry, you can't bear it because you want to eat. But healthcare is interesting. If you say, I want an appointment to see a doctor, they'll say 3 or 4 weeks. Say, oh, yeah, it's okay, no problems. We're desperate for a taxi, we're desperate for Amazon books, but healthcare, we've got to reverse that kind of genealogy. That's more important to us than Amazon books, surely. And so that's the kind of concept we have to think about. Immediacy, how to access healthcare, and that's really important.
Sure, fantastic. Well, do we want to see another one of your videos?
I'll show you a few videos. Let's show you one of these.
Yeah.
So this
and think of some questions whilst these are going, because I'm going to come to the audience.
This is the operation we did a while ago using VR for the first time, before anyone thought about doing VR. So I thought about how do you bring people to operating theatre? So we did this, I think, back in 2016.
This 360 camera rig allows immersion. People around the world using a low-cost technology, a simple VR headset, to actually immerse themselves in operating theatre around the world.
So going from that, the whole question is around the doctor-patient relationship will evolve from this. So the question for me, for the audience, is the moment you expect to see a doctor, kind of face-to-face, you want 15, 20 minutes of their time, GPs get 10 minutes of your time. The question is that viable? And I think it's too expensive. So now, in healthcare next 2 to 5 years, the first point of contact will not be a human being. It won't be. It'll be an AI chatbot. It will be a hologram. It will be an avatar built in with AI, deep machine learning, who will talk to you, like Sophia the robot that you've seen, and I interviewed in Dubai a few weeks ago. So that's going to be the future. And it's what that social re-engineering required for the public to say, look, we can't afford face-to-face contact. We've got to do it a different way, maximise the opportunity using all these technologies to access healthcare, like Babylon Healthcare and Ada Healthcare now. The first point is an AI chatbot, intelligent deep machine learning system. They'll tell you about your diagnosis and perhaps even give a prescription and you can walk away. It takes away a lot of the burden of healthcare. So if you look at that, I was thinking about, hey, how do I use kind of holograms and things? Can I do an operation and have people from around the world in the same operating theatre together in 3 different places? So this is me operating in London, and I had a surgeon using his avatar from India, one from America, in real time, in the HoloLens, in my operating theatre, sharing knowledge using scans and images. And imagine that in real time, you can just access a doctor anywhere in the world. So the HoloLens itself really allows us to reshape the way we connect people, we communicate with people, and also to be used in teaching and training. Initially, when you put the HoloLens on, it feels a bit strange, but actually within a few minutes, it becomes quite normal. You feel as though you're just discussing cases with people in the same room, for example, like we do in normal hospital practice.
We can come in and actually look at this content in full 3D. And obviously when you're working in this case, the medical field, having a full 3D understanding of a situation, for example, is really much more powerful in solidifying how you want to navigate it in your mind.
So some people said to me, but that's not real, it's avatars. So I went back. I thought, can I actually holoport myself in real time? I'm not just an avatar. This is what we did with a company called Holoportal.
Let me have a look over your shoulder. Oh yeah, I see what's going on there. I think I'll give some advice, Carl. No problems. Thanks for calling me.
So Tom travels a lot, he tells me, and so do I. There's a much cheaper way of travelling, Tom, and just why do you want to travel when you can just do holoportation in real time in the future? This is the future, isn't it?
Yeah.
And that's my Princess Leia moment, by the way, looking for Obi-Wan Kenobi. I was in a dream to create that image in my mind about Obi-Wan Kenobi, right?
Fantastic. Fantastic.